Hello, everyone, and welcome to today's webinar, the Association Health Plan, the Introduction. My name is Carmen Rustenbeck, and I am the founder and CEO of International Boarding and Pet Services Association, and we welcome each of you here today. This is a first in a series of webinars that will happen every Wednesday at the same time, 12 o'clock Central Time. So if you miss anything today, we will also have it recorded and put in our member library for the members. And for the non-members, there will be a link available on our Facebook page where you can click and listen if you need to again. But every week, we will be discussing the association health plan. Before we get started today, I wanted you all to know that, again, we are recording, and that there's also a question box. So somewhere on your screen, you should have the ability to type in a question, and those questions go right to Natalie. And as those questions come up, Natalie will make the decision whether she's going to interrupt our guest today or we're going to save it till the end. But be assured that the webinar will not end until we have everybody's questions answered. So before we get started, let me introduce our speaker today. Her name is Tracy Kaiser, and she is the president and CEO of the Kaiser Group. Tracy began her professional career in the insurance industry with a focus on risk management in 1984, shortly after graduating from college with a BA in finance and marketing. She built and maintained 4 successful private practice firms between 1984 and 1997, encompassing multiple state locations. In 1997, she was asked to accept an officer role for a Fortune 200 insurance company overseeing all operations in the Western United States. After leaving that post in 2008, receiving accolades as being the most accomplished in that position in the history of the company, she returned to private practice to continue to pursue her true passion for improved effectiveness in overall benefit management and strategic product development. She maintains a strong emphasis on meaningful benefit plan design and deliberate cost containment strategies with each business client the firm represents. The Kaiser Group has become a very sought-after firm to accomplish the goals necessary for today's business owners. Tracy sits on several boards, serving the insurance and financial industries, and is a consultant for several employee benefit firms and marketing executives. The Kaiser Group's reputation as an ACA, which is Affordable Healthcare Act consultant, resource is very well known, with consulting integration included as part of overall strategy management in numerous national firms. Tracy, thank you so much for being with us today and helping our members learn about our new member benefit.
Thank you, Carmen. It's a great pleasure to be here, of course, and thank you to everyone for joining the webinar this afternoon or morning, depending upon where you are in the United States, of course. It is certainly our pleasure to be in partnership with IBPSA in conjunction with WAFD, which is Washington Federal Bank Insurance Services Group. The Kaiser Group and Washington Federal Bank formed a partnership some time ago to have greater presence in the United States and to bring greater services to the employers throughout the United States. And the Kaiser Group, and as you will notice, and for those of you who are on the webinar, the Kaiser Group brings to the group here a competitive partnership, nationally recognized, so that we can service all the states in the United States that you may reside in. We're certainly experienced for many years in the association world, and many years going back to when association benefits were available before they were removed from associations. And now that they've been reintegrated into the benefits community, we are certainly a leader in that area as well. We're a risk management focus group and certainly experts in both small business and large group business for insurance. Certainly many of you on this call, or the great majority of you on this call, are small business owners, but as a group, of course, you form a very large risk pool. And so you are a very unique project in the scheme of all insurance, and that's the area of expertise that we have and bring to you as we continue to move forward together, bringing competitive benefit programs to each and every one of you at the individual independent contractor level all the way up to the larger group level. So with that in mind, we'll actually get started. And I do want to certainly extend congratulations to the IBPSA because from an association standpoint, association benefits are certainly a hot topic right now. As we will discuss throughout the webinar, certainly the laws have changed to allow associations to chair, if you will, benefit programs for their membership. Many associations have yet to engage, simply lack of knowledge, lack of resources, lack of consulting, et cetera, et cetera. But I do want to congratulate Carmen and her staff for being very proactive and certainly reaching out and doing the research necessary, all the due diligence necessary, et cetera, to bring the best of the benefits available in the marketplace to you, certainly at a very, very large scale. And we'll go through that as we continue through this program this morning, and in additional conversations with each and every one of you, after the program. From a member marketplace, I want to just kind of set the stage for where we are. And as Carmen mentioned, there will be ongoing webinars from an educational standpoint, an engagement standpoint, et cetera. So what you may or may not retain from today, of course, you will be able to access it through the website, but what you may or may not retain today will certainly be brought back to the surface, time and time again in different capacities. But I think that everyone is very well aware, and certainly everyone is facing it themselves. I mean, the world of health insurance, and health insurance being the key component that we will talk about, other components, dental, vision, life, et cetera. But medical insurance is really the key component, and that's really where everything starts. It certainly has been a changing dynamic. There were not that many years ago, it actually was an affordable product for each and every one of us to have, whether we purchased it through our employer or in the open marketplace. In today's world, it has become literally unaffordable for most folks unless you have an employer or a new association type relationship to bring a better price point to the table. We know that the legislative changes have occurred, both through Obamacare, of course, several years back, and now with the Trump administration and the new exposure, through associations. Obviously, for employees of any of you out there that have employees, it's been a challenge for them as well. If you are a small business and you have employees, certainly there have been strong limitations in what you can bring to the table and price points that might not be, affordable for your employees. For those of you who have larger firms, obviously the employees are able to engage in somewhat of an affordable fashion. But the objective is to really bring efficiencies to the table, streamline where the benefits and price points can be streamlined, and bring a structure to the table that is affordable for you and your employees, but also market leading from a benefit standpoint, because the objective of being able to not only attract employees, retain employees, and certainly take care of yourselves as owners, those are obviously our objectives. Retention of employees is very important in today's world because it's very difficult to get good employees. Always easy to get employees, very difficult to get good ones, of course. So from a purpose standpoint, a member value standpoint, the objective when we spoke initially with Carmen, and certainly which has been sustained throughout the relationship, is that it's important that there be substantial value for each and every one of the members, be meaningful and certainly attractive, not only to the existing members, which certainly it is the responsibility of the association to service, but also for new members who might be considering membership with the association. From an engagement standpoint, the association, in conjunction with our firm and certainly our partner relationships, will be incredibly impactful. Obviously, the focus and drive is for the member usage, meaning that the benefits that are available to you are those that you need, that you're going to use, that you're going to engage with on a regular basis, not anything that's superfluous, if you will, and unnecessary in the whole world of benefits. So the key is to make use of the money, your money, very effectively, and to make sure that we stay within budget for you at every cost. So considerable cost savings, of course, throughout benefit programs, and improved profitability is the end result for each and every business. that we all know that insurance is a cost of doing business. It is not something that generally has a very specific impact to your profitability in terms of growth and positive profitability. So being simply a cost of doing business, it's important that we keep that cost really as efficient as possible so that it impacts your profitability in a positive way, certainly not dragging down that profitability. And from a member value standpoint, of course, the IBPSA should become, in very, very short order for you, a leading benefit source. We expect that to occur in the next few months as everyone begins to engage. We begin to do the analysis for each and every one of your businesses, et cetera. You will find that the IBPSA will be your go-to source for anything related to benefits, insurance, obviously your business planning in the current environment, and so on. The market's going to continue to change. There will be ongoing adjustments to the insurance industry. Many of you live in states where the selections are incredibly limited, and many of you live in states where the prices have become absolutely unaffordable. And so expect that market to continue to change. Expect that market to continue to evolve. And certainly we can't expect the price points to go down. So you hear a little bit on the news here and there about some reductions in price. Usually that's very, very temporary and very, very specific. So, trend lines in healthcare are continuing to go up and they continue to grow at double digits. When trend lines are continuing to grow at double digits, it requires us on the insurance side of the business to be more and more efficient, to manage claims better at each and every turn, to manage your services better, et cetera, and to continue to negotiate all the way through that process. Our objective is to make sure that each and every one of you as employers are leading the market so that you are attractive for any competitors that might be down the street, might be in the same community, in your areas. We want to make sure that when you're out there looking for employees, that you are the best game in town, if you will, that you are the most attractive employer in that space. And for those of you who are single employers, that you do have a resource to actually take care of yourself as you and your family members, of course, so that you don't have to make a decision on whether or not you choose health care or certainly supplies or equipment for your business. You can actually take care of both sides of your business and make sure that you, from a health standpoint, are taken care of. Obviously, the focus for Carmen and the IBPSA is very much that of profitability for each and every one of your businesses. Not only the short term. Anybody can say, gosh, let's save some money on insurance on the short term. But really for the long term. Everything that we'll be working with you on through this process will be establishing programs that are manageable and that are focused on the long-term maintenance and growth of your business with solutions that actually make sense for each and every one of you as business owners and for those of you certainly who have employees or just single independent contractor type businesses or single employer businesses. The challenges we face right now, and certainly this doesn't change and hasn't changed for a few years, but are becoming more and more apparent. And it depends upon the state you live in, but nearly every state has continued to limit the options available. Associations prior were withdrawn from any kind of involvement. The Trump administration introduced this year association health plan legislation that has opened that door back up again, much to certainly the excitement of an association that is proactive like your IBPSA association, but also much to the happiness of members because you look to your association to help create that buying power and help drive down costs in many areas. And now the insurance side can be brought to the table again. The association's involvement will continue to change, continue to grow, which is going to be helpful for everyone, of course. And, in the past, not only, medical insurance has been expensive, but all the administrative services associated with medical insurance, associated with dental plans, vision plans, life insurance, et cetera, have all been too high. And so it's been impossible to actually create any kind of comprehensive portfolio, not only for you, but also for your employees. Coverage has been unavailable for those who were small employers or single employers. And the options have been, financially unreasonable, as we spoke about. Unfortunately, because of the nature of your business and because of the size of your businesses, what you have probably experienced is that insurance agents, consultants, et cetera, have really walked past. And so there's not been a lot of guidance. Fortunately, because of the new legislation that has introduced access for associations again, that guidance is now brought back to the forefront and certainly benefits not only the larger employers, but benefits each and every small employer as well. Membership here with the IBPSA will benefit greatly by having access to large group benefit structures and large group benefit advantages, but being a small employer, you won't have the negative impacts of that small employer status. And so I think that's very, very exciting for every single member. We should look at, certainly when we talk about out-of-pocket costs skyrocketing, your out-of-pocket costs will start to become managed, will start to become maintained, will start to reduce, et cetera. And I think that's also exciting for each and every one of the members here on the phone. From a legislative standpoint, just to make sure that everybody kind of understands, how did we get to this point, and how is it that for years we've not been able to really access great opportunities, but now suddenly we can? Well, it's really been about this year, 2018, January of this year. The Association Health Plan rulings started to come into play and were presented to the DOL, Department of Labor. March of this year, Small Business Health Fairness Act was passed. In April, the state DOIs introduced and passed state approvals or rejected state approvals. There are a few that have rejected. It doesn't mean you are limited in what is available. It just means we have to work in a different structure for you. It's only a couple, so don't worry about those. And then, of course, from the rules, compliance rules, ERISA, which is federal rule, and all the other compliance-related laws were all established. June 19th of this year, the DOL actually passed all of the compliance approvals and introduced and delivered the association plan regulations to the marketplace, with a starting point being September 1st, and then really through a structured wave of introductions, with the beginning introduction starting in September, then extending through January 1, and then, of course, after. So the introductions, you're not far behind anybody by any means. The introductions just started in September of this year. Again, it's an exciting time for small business owners today. Your primary source, as we spoke about, will be your IBPSA association. I will tell you that with anybody in the outside world, whether that's your local insurance agent, your best friend who's an insurance agent, your family member, etc., the availability they will be able to bring to you will be incredibly limited compared to what the association will be able to do for you. So I always encourage everyone to look to the association first. From a confidence standpoint, your association is incredibly engaged in everything that we do and everything that we will be bringing to the market for you, and certainly has a voice and an opinion and involvement in all those decision-making scenarios. Certainly from a membership standpoint, everyone pays a membership fee, including our firm here as well. And it's important always that we get as much value for that membership fee. And since this is an introduction today, obviously the objective is to really set the stage for how we got here, what is the involvement of the association, how is this going to benefit everyone, and then as we close down the slides in just a few, we'll talk about specific benefits as well. You'll be introduced, if you will, to the whole world of choice. As a small business owner, you don't have much choice or haven't had much choice in the past. And that's rather frustrating, because the bigger the business, the more the choice. Because you are a part of a very large risk pool and a part of this association, you will now have that advantage of choice with expanded quantity of care, meaning networks that are greatly expanded. Quality of care, of course, translates from quantity of care. And the more opportunity there is for more choice, the more opportunity there is to expand those networks, the more opportunity there is to see the doctors you want to see and get the care you want to get at the great majority, if not all, of the facilities that surround you or are in your local communities. From expanded coverage options, of course, this also then works within your personal and financial choices. Unfortunately, again, being small business owners for the most part, the pain is felt very obviously when someone presents you with what the rates will be for your medical plan. Because of this expansion of choice and the expansion of benefit availability in general, you now will be making decisions far beyond just, here's one option and here's the price and so on. Now you have more options, more deductibles, more copays, more strategies to talk about, think about, and fit within your budgetary control. Certainly, flexibility of coverage, whether you need coverages that have maximum benefits, and we think about those as gold plans, platinum plans, etc., or whether you need coverage and maybe it's because of your age or your medical status or whatever, that you only need minimum coverage, whether that's a bronze plan or even far less than a bronze plan, but just an affordable plan for day-to-day care. That whole gamut is now available to you. So again, it fits within your personal and financial ability to pay and personal decision making. And then again, retail marketplace. The retail marketplace is exactly what it is. It is a retail marketplace. All of you, obviously, as business owners, work from a wholesale perspective when you're working with your suppliers and so on and so on. And it's unfortunate that as it relates to insurance, you then have to move over to a retail side. You now are moving back from that, being a part of your association, and into that wholesale environment. So you're getting the advantages of cutting out all of the excess expenses that go with retail side of business and back to the wholesale side, and then, of course, reaping more and more reward beyond that as well. From a benefit plan menu standpoint, and this is just a small little sampling, there's an entire gamut of what can be done, certainly in the medical and ancillary side of the business. Whether you're an owner, whether you're an employer, or whether you have employees, obviously medical is the important point of the structure. And as we spoke about, large group plan structures will be your focus. Obviously, because you run the gamut of the entire United States, it's important that there be national access versus limited networks in geographical areas, like you've heard of HMO plans, etc., or just primary care networks that are localized, etc. In this scenario, whether you live in California and you travel to New Mexico or North Carolina or New York, you will have access to those networks anywhere you go, so you are not limited. The networks that we will work with will be far expanded than your traditional standard medical plan networks, in the respect that because you are a large association plan, we call that in our side overlays, we overlay networks. So whether you're used to an Anthem network, an Aetna network, United Healthcare network, whatever is in your current marketplace, HealthNet, etc., you will be able to access those same physicians, those same providers, etc., to a very, very broad spectrum of network overlays. So therefore, you don't have to say, gosh, what network is best for me? Is my doctor in the network? The great majority of the time, if not nearly all of the time, your doctors and providers will be in that network. And we have a whole staff that does nothing but reach out to providers and physicians, all of the time, engaging them in more and more network access. So if some of you are in remote areas, always challenging, of course, you will not have those same challenges that you have experienced in the past. And we just go right to the localized communities when we have those remote areas. So for those of you who are impacted in that way, I think you'll find some relief. We talk about expansive to minimal. I just spoke about that a few moments ago, large plans to small plans, and certainly a tax-advantaged medical side of things. There are certain tax advantages, whether that's business expense, whether that's pre-tax for employees, and so on and so on. There's a whole gamut of tax advantages by having a group medical plan for your business, for yourself and or the employees. But beyond that, medical is the starting point. We all recognize that because that is the thing that can bankrupt us all financially, and that is a medical condition that might be severe. Things that are handled day to day, we don't get too concerned about. But what we do like and what is attractive to ourselves as well as for employees that come on board are, other plans such as dental plans, vision plans, life insurance, disability plans, short-term, long-term, catastrophic coverages. If someone has a high deductible, they're not necessarily expecting to pay that high deductible, but if they have a catastrophic situation, how do they take care of that deductible? Those kinds of coverages. Wellness is an important component in today's world of healthcare to help keep people healthy so they don't experience high dollar, out-of-pocket dollar expenses. Long-term care, for those of you who are individual employers, that is a very prominent part of planning for the long term, unless you have, other family members, et cetera, that are dedicated to taking care. Oftentimes people are looking for outside sources. So those services and programs will be available as well. And for those of you who are over age 65, Medicare assistance with the supplemental side of care and coverages are very, very important. And so we'll be able to assist you with that as well. And then, of course, retirement planning. You know, as a business owner myself, and certainly speaking to business owners here on this call, you know, it is incredibly important that we rely on ourselves to create our own successful retirement. And so we'll be working with you in those capacities as well to at least help position you to take advantage of the work in the years that you are investing into your business to make sure that you reap that reward long term, and then working in conjunction with your other business succession planning that the association is providing through other resources. So I think from a gamut standpoint, we're running the full gamut in terms of healthcare. When you go to the market and you go to hire employees, you'll be able to say, we have a benefit program, and we have an attractive and competitive benefit program that will far outshine your other competitors out there. There's no question, unless they are a member of the IBPSA, of course. But we talked about, I think I just went backwards. Let's just go, there we go, sorry. And from a benefit support standpoint, this is not a situation where you're going to choose or have the opportunity to choose benefits and then you're kind of on your own, not by a long shot. Your services and your support will be 24/7, certainly in terms of access to benefits and support. You will have certainly a dedicated service team that is IBPSA dedicated. No 45-minute hold times for anybody who's been holding online for whether it's Obamacare, the exchange, or whether it's just simply your insurance carrier. I can't tell you how many times we've been on hold, and I know that you've been on hold as well. We try to keep our hold times down to just a couple of minutes. And certainly if there is a situation where you leave a voicemail for some reason, those voicemails are returned same day, unless they're end of the day, and then they're returned the next morning as well. So you will not have situations where you're just out there on your own and trying to figure out what to do. Our job is to help you every step of the way. So this is one of the easiest parts of your business. And from a transitional standpoint, whether you're transitioning from other coverages or whether your employees are transitioning to your company from other employers, the objective is that it be easy for you, painless, of course, and that it be streamlined from our side of things so that we can provide you with that same support. From a patient standpoint, patient advocacy becomes very, very important. How many times do you get bills in the mail from your doctors or hospitals and you don't even know what it's for? You don't know why you have it. You know it's probably wrong, et cetera, and there's no one to assist you. How many times do you have the opportunity to be referred somewhere, but you don't even know why? Patient advocacy is very, very important these days. So when someone needs assistance, whether that's with claims assistance, whether that's simply with understanding the EOBs, explanations of benefits, whether that's assistance in referrals to providers, those things are all important. And you can't rely typically on the traditional insurance company to help you, nor can you rely on family members or outside sources to help you. They just don't have that same level of knowledge. And so we incorporate a whole patient advocacy department that works with you as you have those kinds of needs and face a challenge of working in the healthcare industry, of course. From a technology standpoint, you're going to be experiencing new technology advancements, which I think are going to be exciting as well, because we all live in a mobile world these days. And of course, some of it is generational. So for those who are not necessarily as technologically savvy, don't worry about it. We still do everything manually as well. But for those who are, 20 years old and have grown up with only technology, certainly most everything that can be done from a manual perspective is also being done from a technology perspective as well. You'll have the opportunity to go out on your phone, click an area, a street, a type of service, etc. See all the people that provide, whether that be MRIs, labs, etc. Any of those kinds of things. Touch your phone, all the MRI providers in the area will come up. Even their price points will come up. So that kind of technology is coming to you, and certainly that technology is here today. Whether you have a dental card that you're used to carrying and don't want to carry it anymore or have lost it, you just click on your phone, shake your phone when your app comes up, and your insurance card comes right up. So those kinds of technology enhancements I think are exciting, make our lives a little bit easier, keep you from having to spend a lot of time, in inefficient parts of this business. But from a financial standpoint, as we kind of wrap up here, from a membership standpoint, as a member, we want you, in conjunction with IBPSA, to gain value from this membership. And there is tremendous value with IBPSA. There's no question. We align with very, very, very good associations. Not every association in the United States, and certainly a very limited number, but very good, very well respected, very comprehensive associations that actually are credible and certainly have the confidence of their membership and bring a lot of value to their membership. The objective here, bottom line, regardless of the things we've talked about and the things we will talk about in the future, are to lower the cost of healthcare for you and your employees, and then lower the out-of-pocket costs. And what are out-of-pocket costs? Those are deductibles, co-pays, exclusions, limitations, just items that are not covered in general, but lower those out-of-pocket costs, because the cost of healthcare, your premium, plus the cost of your deductibles and co-pays and so on, is really your cost of healthcare. And so we have to lower both of those areas by improving the benefit plan models with better co-pays, better plan specifications or plan design, and then improving the benefit expense loads in general, which we just spoke about with deductibles, co-pays, and so on, and more things covered versus less things covered. More doctors in your network versus more doctors out of your network. Many things that you've experienced in the marketplace has been constant reduction of care, constant reduction of coverage. That is not the right direction. The right direction is to go the other way, but manage the claims better, manage the services better, manage the plan designs better, and be very, very proactive in your marketplaces to make sure that the price points that are being paid to the doctors and hospitals are the right ones, not overpaying, which then drives up costs, of course. And then the bottom line always is a healthier workforce. A healthier workforce is better for business, certainly better for, your stability of your business, and certainly better from an insurance standpoint as well. So what will happen from a post-webinar standpoint, and I'm happy to entertain questions and so on. Natalie, if you're, voicing those as well, or I can pull those up here on the screen. But what will happen here is, as we finish this webinar and we all kind of go back to business, of course, we will be reaching out to each of you in mass and sending you a document, if you will, very brief, of course, so that you have the opportunity to send it back to us with your interest in pursuing information. This is not a commitment to do business together. It's not a commitment to join any of the plans, etc. But it is a commitment to extend the effort to reach out and inquire about benefit opportunities, benefit designs, benefit availability, all of that sort of thing, and to provide some basic information so that we can underwrite the plans and underwrite the rates properly. For an association plan to be successful and to work really well, it certainly can't be a plan that one or two folks are interested in, not that that would exist, but just as a kind of a reference point for education. It has to be a plan that the great volume of members are interested in, because that creates the larger risk pool, which then creates the competitive rates for everybody who's a member and for your employees as well. And so it is important that we all extend the effort post the webinar if we are interested in pursuing benefits or interested in joining the association to pursue benefits, etc. It is important that we respond. It is important that we provide, basic, information so that we can actually underwrite the risk for everyone. We will not be asking for your personal data that exposes anything from a HIPAA standpoint. We will be asking for information that really is nothing more than just underwriting. So we appreciate each and every one of you. I certainly do appreciate the time that we have shared today. And Natalie, I will turn the call back to you if you'd like to offer up any questions.
Tracy, this is Carmen. Before we get started, folks, I know a lot of you are posting questions about what exactly is the rate going to be and how is it calculated. So, Natalie, let's start with the first question. I'll start with that question, then Natalie can fill the rest for us. So, Tracy, it says association risk pools experience rated. Based on that, how will rates be determined? There's several questions at once here, so hang in there. Is it based on the number of individuals that belong to the association and actually take the insurance. That's the first part. And then it says rates are also determined by regions. So are rates going to be uniform across the states or just plan designs? Additionally, certain states require different benefits. How will they be addressed?
Certainly, and those are a lot of questions in one question. So we'll try to chip off each of those, and if I miss any, Carmen, don't hesitate to go back and have me answer those. From a state perspective, as it relates to association plans, we do have to respond to state regulations. And so therefore, plan specifications do follow state regulations. And so as, depending upon where each person lives, there will be changes in your plan. So someone who's in Delaware versus someone in New Mexico will have slight differences based upon requirements of those states. When it really comes down to it at the very end of the day, most of those differences are specific and limited. They're not mass differences, but we do have to respond to those. So there will be, as you are a member in various states, you will have certainly the benefits available in your state, and then changes if you're in a different state, et cetera. So that is a requirement, of course, and we are responsible for making sure that's managed properly. From a risk standpoint, yes, the objective is to underwrite the entire risk of the association and the members within that association. From an underwriting standpoint or an underwriter standpoint, certainly we assess that risk based upon the information that we're gathering here post this first webinar and information over the next couple of weeks. The objective is to roll out the first plan with an effective date of January 1 of 2019. I can't believe I'm saying 2019 yet, but nevertheless, January 1 of 2019. And so for those of you who are right now in the quandary of, gosh, do I go for an Obamacare plan on the exchange, or do I do this, so on, you'll certainly have the opportunity to have rates and plan design far before the deadline necessary to make that decision with Obamacare. And so, excuse me. And so, when you're dealing with experience rating and so on, of course, from an experience rating standpoint, we don't have experience on the group right now. So we have to underwrite based upon what information is available. And then as the group goes on and matures and what have you, you have the opportunity to experience rate, of course. So initially, there's always a more conservative approach, and this is more the technical side of insurance, but more conservative approach to underwriting to allow for room, if you will, for any excessive expenses that are not necessarily uncovered. When in today's world, as it relates to underwriting, this is very different than just a few short years ago. With birth dates, with information about folks, we can capture great historical medical information that's available in the open market from an insurance company standpoint. However, withstanding that information, with simple ages, geography, genders, we all know, and again, from an underwriting standpoint, we all know the risk factors. We all know, what's the word I'm looking for? Not systematically, but we all know statistically, statistically speaking, what percentage of folks have certain kinds of diseases that are severe, and other, what percentage have, diabetes, what percentage have heart conditions, and so on and so on. And underwriting has become much more scientific than it has been in the past. It's still somewhat discretionary, but years and years past, it was very discretionary. Now it's much more scientific, and we have access to much more medical data than we used to have access to. So the underwriting process, though it is still very complicated, is not as, it's much more fail-safe today, is not as, movable, if you will, as it was years past. And that's probably not the best way of explaining it. But with the information that we'll ask from each of you, and with the delivery and analysis back, you'll certainly have your rates. So the rates will be established in each of your states, and the rates can vary by state, certainly because the marketplaces are very different, and the cost of care is very different. So, for example, someone who lives in Los Angeles, for example, versus someone who lives in Mount Airy, North Carolina, would have different expense loads associated with medical care, and needless to say, those rates would reflect that. And so it won't be confusing for each of you, obviously, when you're looking at plans and availability, because you will be accessing the information that is available based upon your geography and based upon, certainly your business and so on. And so will someone who has 5 employees have the same rate as someone who has 2 employees? That would be the expectation I would have if I were you as a member, of course. Someone who has 100 employees or 1,000 employees, which I don't think we'll see that. But let's say someone who has 50 employees, will they see rate advantages? Certainly. And are there more things that they can do in general to reduce some costs? Probably. But will they still work from the same platform as everyone that is in, a 5 or 10 man group or 1 person group? Yes, absolutely. I'm not sure why that came up on the bottom of the screen, but nevertheless it did. So anyway, did that answer the question, Carmen?
It does. And I would like to encourage, let people know that all your questions are going to be downloaded and sent to the Kaiser Group for more specific answers if we can't get it covered in the way you thought it should be covered here. Also, I know that many of you are losing your insurance company not because of anything you did. It's just your insurer is making decisions and has notified you that they will no longer be insuring your company or you. So please let Tracy know. Tracy's going to be sending everybody a form to complete. You need to let her know that that's happening to you so that she can address that quickly, because it's different for you if you're being dropped December 1st as opposed to you have insurance and you're just trying to make a decision. So please let her know that. Natalie, I'm hoping you've had time to look through the rest of the questions.
Yeah, more or less.
Okay.
So we have a few questions about the upcoming deadlines. One of them being Medicare supplemental enrollment period ends like December 7th, and the ACA deadline is December 15th. And so we have a little bit of concern on whether people are going to have time to review anything prior to those dates. Can you speak to that?
Absolutely. Again, yes, absolutely. Thank you, Natalie. Without question, the ability for us to turn everything to meet all the deadlines that are necessary is largely dependent on everyone returning the forms as quickly as they can as well. And I say that because we're all professional business owners here on the telephone, and so it's important that we all really support each other in that capacity. We would expect that for your group, meaning the IBPSA, that we'll be able to turn rates, plans, everything back to the group. And again, Medicare supplement's separate, but let's talk about the medical part first, the ACA part, by the 1st of December. So that still gives 2 weeks time to be looking at the plans and so on. And that's only 3 weeks from now. Now, for the folks who are in the Medicare supplement side of things, as it relates to the deadline of December 7th, at the close of Thanksgiving, meaning that Monday right after Thanksgiving, we will be able to deliver out to those folks who have that need, plans and so on, that work within your, geography. They're priced appropriately for you, et cetera, and be able to assist those folks. So we will, in the document you receive, you will see separation so that you can identify what your specific need is, what categories you are in, and also we will ask you to prioritize your need. For example, some folks may be on the phone or on the webinar thinking, gosh, I just want to kind of look. I'm not sure I want to do anything yet. I'm happy with what I've had, and everything's fine. So that's not a high priority for us to get back to you very quickly. Another person may say, I have to make a change now. I've already received my letter that my insurance carrier is no longer going to be covering me. I don't want to go into the exchange. That's not a good situation, et cetera. And so therefore, that's a high priority. So you will be able to, choose what priority level you are at, and literally on the document ask us to reach out to you as a priority versus, priority 1 versus priority 3.
Okay, thank you. The form that you're going to be sending out, is it going to be in a way a questionnaire that they can give to employees to determine their employees' interest?
We certainly identify on the form how many employees you have and ask that question. We're really not in a situation now where we have to inquire about the employee interest. Once we do an initial analysis and plan delivery, that's really the time to then engage employees in interest. Typically, if you just ask anyone if they're interested in insurance, I'm not sure that garners a good interest. But typically when you say, gosh, we can deliver, or we can present or prepare for you or provide to you, dental plan, vision plan, life insurance, medical, et cetera, as an employee group, if that's something you are very interested in, and here's what the plans look like, then the employees usually respond in a much more intelligent answer, of course, than just the yes or no to insurance. The first question when asking employees if they're interested in benefits is always how much does it cost, of course. And you would expect as a business owner that would be the natural question. Without knowing that, certainly it's hard to deliver something back to an employee. However, many of you have had employees for years and have had benefits, and maybe overpriced benefits. And I do thank a couple of folks that have already forwarded some information to us, so thank you for that. But for those of you who already know your employees have benefits or want benefits, certainly we ask you to note that on the document as well, more of a questionnaire type scenario. And you probably know as a business owner if people have been coming to you asking you for benefits because they're in a quandary as well. They're trying to figure out as an employee, do I need to go to the exchange? Do I need to go on to my spouse's coverage? Is my employer going to provide a portion of, contribution, et cetera? And so as a fellow employer, I would think that each of you want to be thinking about if this is your first step into benefits, have I thought about a contribution for the employee? It doesn't have to necessarily be a percentage like half or 35 or 60 or whatever. Just think about it in terms of budget. What is my budget that's allowing me to contribute? Do I have the ability to contribute $200 a month per employee, $100, $300? And again, it doesn't have to be flat rates, but just as an example, would be thinking about that from your perspective as well, because that will be important in very, very, very short order as we come back to you with deliverables. But to answer the question, going back to the question, the document doesn't necessarily ask you for interest of your employees or distribute out to the employees for interest, but we certainly will ask questions that you can answer that tells us how many employees you have. And we know that for the most part, every employee or every person is supposed to have insurance in the United States today, and whether that's through you or whether that's through the exchange, that's supposed to occur.
Okay. Will it be possible for just one person, I'm presuming that's the facility owner, and their spouse to buy into the plan, even if they don't offer it to their employees initially?
It is possible for individuals to join into the plan. However, that said, I want to speak to the discrimination issue. It is important from a true business standpoint that you pay particular attention to discrimination issues, so that, and we can work with you on the details of that as well to advise you properly, so you're not setting yourself up for a situation that could be discriminatory, or unfair, et cetera. So, as those questions come up individually with those employers, and we identify, how many employees you have, are they full-time, part-time, are they in different class of employee, et cetera, then we'll be able to counsel you as well on the discrimination side and give a definitive answer on whether or not you as a specific business owner can separate yourself in terms of benefits.
Okay, great. It sounds like some folks have policies now where they're required to pay at least 50% of the employees' plans. Is that going to be a requirement for this one as well?
Under Obamacare, that requirement and expectation really has existed. Most of the business owners in the United States today contribute 50% or more of the employee or the total premium for the employee level lowest plan available. So there's a couple of criteria there that kind of fall into the requirement. So if you have, for example, you might have a veterinary clinic for someone who might be on the phone today, and you might have two plans available. You don't have to contribute 50% of the best plan, but you do have to contribute 50% of the lowest plan. And so you do have a little bit of flexibility there. If you're involved with employees, there are more requirements in terms of the employer contribution as it relates to medical plans versus if you just have coverage for yourself, or, it's a little bit different scenario, multiple employer, common ownership, those kinds of things. And the other side of the coin is that requirement is really only related to medical plans. That requirement has nothing to do with dental, vision, life insurance, other coverages, and so on.
Well, here's everybody's favorite question. Can you talk about pre-existing conditions?
Pre-existing conditions have to be covered as they are today, meaning under ACA, pre-existing conditions are required to be covered without any exclusion. I know that's been in the news quite a bit, and you are not, we're not approaching the IBPSA with the plans that you're hearing about that people exclude pre-existing conditions. And those are short-term plans and some unique kind of plans that are really not true medical plans. They might be supplemental plans. They might be something you use for a specific purpose, but they are not a part of your association health plan program here. Now, that said, other insurances are always available, and you can choose other coverages in voluntary side, meaning disability, critical illness, those kinds of things that do have pre-existing condition clauses on them. But I'm referring to your basic medical plan. We'll be providing you with a portfolio of plans that follow all the ACA guidelines, which means that pre-existing conditions have to be covered, children have to be covered up to age 26, et cetera, et cetera. And, the maximum out-of-pocket maximum have to meet the ACA standards and so on. There's some bad press out there for association health plans for a whole host of reasons, whether that's political jargon and political, bantering that's going on, or whether that's just because there are some unsavory folks out there that do solicit and prey on new opportunities to bring bad programs to market. That said, your association health plan portfolio will not be made up of that, but any plans you choose outside a health plan portfolio, like a critical illness, like a limited medical plan, like a short-term medical plan, those kinds of plans all fall into that category. Does that answer that question?
I think so, yeah.
Okay, super. Well, that's an easy question, even though it is one that's most popular in today's news media.
Yeah. We have someone whose renewal date on their current plan is July. So if they decide to make a change, do they need to wait until July?
No doubt at all, and thank you for that question. That is a common question that comes up. Every insurance contract in the United States, unless you have signed an independent agent agreement of some sort, which are very few and far between, you have they're all 30-day contracts. In other words, your coverage can be changed with 30-day notice given to your current insurance carrier. Now, if you are on a self-funded plan, you have some other requirements that we can speak to individually, but they may involve minimum premium requirements or minimum periods of time. Chances are most of you are not in a current self-funded plan unless you're in a PEO or unless you're in some other kind of association plan. So we can deal with those on an individual basis and help counsel you on the timing. The great majority of folks will have standard medical plans, and those plans can be canceled at any point in time with 30 days notice and no penalty. And it is quite common for businesses to change their plans before the renewal date. Years ago, people kind of fell into the kind of a lax approach of, gosh, I only look at insurance once a year, and my health insurance anyway, and I change it once a year. Well, it's too expensive to just really put it on the side burner like that. You really have to stay on top of it like any other business expense, and you really have to manage that business expense so that you change it when you need to change it, and that just requires a 30-day notice, unless you have, again, a unique scenario that you might be involved in, like a PEO or, some self-funded plan that might be a part of a different association or a different large conglomerate of some sort.
Okay, thank you. Will you be able to help people compare their current plans with the new plans, specifically regarding prescription discounts?
Of course. We can certainly, to the extent that we can access their prescription information, and for the most part we can access their prescription information, but again, in case there's something unique, we'll be able to discuss that at that point. But generally speaking, we will do a comparison for each person as you request or need it or want it, et cetera, versus just leave you to do that on your own, of course.
Okay, great. What if our staff are 1099 independent contractors?
Well, in that situation, again, the question would be, are those 1099 folks members of the association? If they are 1099s, they're certainly not your employees, and they cannot be on an employee plan. So if they are 1099s, I would assume the requirement of the association, and we would need to get clarity for that, they would need to be a member of the association to be able to access benefits that are available to the independent contractors that are members. So from a theory standpoint, if you will, in terms of insurance law, an employer-employee relationship is pretty defined, and you certainly don't want to cross over that line. If you have 1099s, we would never recommend trying to, be gray about that, because if you have a situation where someone has a medical plan, you've put them in as an employee, but they're really a 1099, and then they, of course, have an injury on the job. There's an interpretation there. As we all know, the IRS is becoming stricter and stricter all the time. They can then start claiming on workers' comp. There can then be severe penalties for employers and so on. So if you do have 1099s and you want to extend an opportunity for them to have insurance coverage, my belief is, from an IBPSA standpoint, though Carmen would have to verify, is they would need to be members of the IBPSA, and we could not make them a part of your employer plan.
Okay. Next question is from somebody in Alaska, where they have really high healthcare costs and limited number of providers. Will this association plan bring more options for them?
Well, we certainly can't put more providers on the ground, but there'll be more providers in your networks. The providers that are there and are, working on the ground, the great majority of those, and we'll continue to expand that as we uncover any holes, if you will, from a network standpoint. So yes, Alaska is one of my favorite states, by the way, for those folks who are from Alaska, and we're very familiar with the Alaska medical market. And so, some of the areas are very remote, of course, but that doesn't mean there's more providers, but you won't have the limitations of providers you have now. We'll be working very, very diligently to continue to expand that provider network in Alaska.
Great. It looks like we might need a little bit of clarification on an earlier answer regarding requiring the company or the employer to pay a certain portion. A couple of other people were asking if that's going to be required. So I think that we might have missed earlier. Yeah.
Depending upon your size, depending upon the type of plan, et cetera, an employer should expect to contribute 50% of the plan. Under ACA guidelines, employers are supposed to contribute 50% or more of the plan. Now, that said, there are states that allow more leniency there, and there are also states who, and depending upon where the person is, and we would address that as we speak with those individual folks as well, there are states also that really hold the employer to that and really do enforce it, and there's case law on the ground where employees have sued and so on for contributions less than 50%. And so we have to be sensitive to the individual state allowances. So depending upon the plan, depending upon the number of employees, depending upon the structure, and depending upon the state, will drive whether or not that mandate is truly a mandate or really more of an expectation. And because we are living in a world of 50 states, we would need to deliver that message based upon the state of residence or the state of the business.
Okay. Let's see. I have a question about, and this may be for another time, but how do we phase in adding health insurance as a benefit? We don't currently reach Obamacare's minimum for requiring us to offer insurance.
Can you say that question to me again? I apologize, Charlie.
That's okay. Whoops, hang on a second. How do we phase in adding health insurance as a benefit? We don't reach Obamacare's minimum for requiring us to offer insurance.
And is the minimum that is being, and you may not know this, is the minimum, you mean the minimum number of employees?
I think so. I think that's what they mean.
Okay. Well, first of all, as a small business, you do not have to respond to the ACA in the same capacity as a large business, though from an insurance standpoint, many of the insurance regulations extend out to every single size business. And so it's really kind of it's a confusing era, if you will, in the insurance industry, because ACA conflicts with insurance companies. Insurance companies respond to ACA. They don't respond to ACA and some other things. And small business, large business have different responsibilities, but some areas of insurance extend over into both sides. So that said, that creates more confusion, of course, but it is a very confusing period of time. So when a small business is asking, how do we phase in, it really becomes a decision of, gosh, as a small business, we don't have enough employees yet, so we don't have to present benefits for our employees, and you still don't have to, even if you're a small business, because you're a member of the association does not throw you into the category of a large business. You are still a small business, and I don't want to get into too many acronyms, but association health plans are built on what we call MIWA structures, which are multiple employer structures, and so you still have a responsibility as a small business under the ACA guidelines. So that said, the reason a small business makes benefits available is usually because they want to attract and retain good employees. And usually employees will leave and go to some other business. If pay scales are about the same, they'll leave for benefits. And so, not everybody wants to keep all employees, but we all do want to keep our good employees. And so that's the reason that small businesses make benefits available, or they make benefits available because they want them for themselves and then extend them out to the rest of the employees to make that work from a budgetary standpoint. But as a small business, don't assume you suddenly have to respond to the large business rules of ACA. I hope that answers the question. I'm trying to, in my mind, analyze or determine what the question really was, and I'm thinking that's what it was.
Okay. We have a handful of questions here about high deductible plans. Are these going to be high deductible plans? If so, are there opportunities for HSA accounts? Those types of questions.
Absolutely. High deductible plans really do have to be a part of every offering because it becomes very budgetary driven. However, lower deductible plans will also be available. And from an HSA standpoint, FSA standpoint, premium only, pre-tax standpoint, et cetera, all of those tools that give you tax advantages and certainly out-of-pocket, support advantages, if you will be available as a part of the overall benefit program, of course. Don't think about a comprehensive benefits program as just insurance. Comprehensive benefits in today's world of employee benefits really do involve all tools associated with benefits, such as HSAs, HRAs, FSAs, premium-only plans, etc., and so on. So we have to be able to accommodate you, each of you, in many different capacities. But for those who are only thinking about high deductible plans or worried that there's only high deductible plans, certainly you'll have an array of benefit options. Not to say that first dollar plans are available in today's world. Those have been gone for a lot of years. But there are ways to work through various insurance products to create a very similar structure that we all knew years and years ago that used to be first dollar coverage, to get very close to that. But that can be incredibly expensive and prohibitively expensive to do first dollar coverage. So now we have to manage risk differently, but that does not mean just all high deductible plans.
Okay. And the last question I have right now is, when you're part of an association, is there a minimum number of employees that you need to have to participate in order to offer the plan?
No, there is not. As an association, particularly an association of small business, we recognize that every business from, true business owners by themselves all the way up to, larger businesses may be a part of the membership and will underwrite accordingly.
Well, that is the last question that I see. If you put one in and I missed it, I apologize, but Tracy will be getting a copy of all of them so she can kind of flip through those and we can follow up on any that we might have missed.
Absolutely. Happy to do that, of course. And I would ask everyone to expect that, in their email, we'll be receiving the participant listing from the IBPSA post this webinar, and then as return response, everyone will receive a questionnaire as well. And again, I encourage everyone, just to support your fellow members, encourage everyone to please return that as well, so that we can, continue to move forward and prepare the proper analysis and deliverables back to the IBPSA membership. The information you see on the screen here, if you're taking a screenshot or go onto the web and get it in just a short while, will all be activated within 60 minutes. So 60 minutes from the close of this webinar, the email will be activated. So accept emails if you have specific questions. and those will also be available back to the IBPSA themselves, and certainly the 800 number will start being answered for the IBPSA membership as well. But give that 60 minutes from now, and that's just an opening, if you will. It opens up all the tools for the IBPSA membership, knowing that the webinar today was the official kickoff of the introduction of the association health plans for the membership. And again, my commendation certainly to Carmen and your staff for all the work that you've done as well to bring these benefits to the membership, and certainly for each and every one of you as members that we don't know yet, but certainly will become familiar with. We certainly appreciate the opportunity you spent today, and thank you for giving us your time today so that we may talk with you about this and certainly create a common point of education and then be able to expand that over the next several weeks so that you're thoroughly educated and thoroughly knowledgeable about what will be available as well. And I'm excited to be able to bring the actual benefits to the table for you, and certainly excited to get to know you over the course of time as well.
Thank you, Tracy. Thank you, everyone, for attending today. I know this webinar was a little bit detailed. That's why we're recording it. And I know you wanted to get right to what's it going to cost, and we're still not there yet. But this is the way we start as an association for the first time ever bringing healthcare to our membership. I encourage you all to look for that form that's coming to your email box. Complete the form as completely as you can and email it back. The faster we have a turnaround, the faster we get questions answered to each and every one of you. Again, we will be here next Wednesday. We'll have more information, and we'll take questions again at that time. Tracy, thank you so much for your very detailed and informative webinar today. I am so happy that we were able to partner and bring a healthcare program to the membership, and I look forward to working with the Kaiser Group and WAFD as we move forward over the next years of healthcare for the pet care service industry. Once again, folks, we're recording this. We're placing it in the member library, and Natalie will have that up in 24 hours. And for those of you who are not members, we will have a link placed in the Facebook page for you to click on and listen to. Thank you all. Bye-bye.
Thank you.